the extra point.
If back in January, we could have showed you that this was what a football game might look like.
Why not? Have fun, jump into the empty stands.
Or that this is how the World Series would look.
Here comes the foot tap.
Or grocery shopping. Or school. Or the workplace. What would you have thought? What must have happened to create such massive and disruptive changes in our lives?
This virus.
This outbreak.
This pandemic.
The coronavirus.
The virus.
The outbreak.
We're sick of COVID-19, we really are.
8 months after we were introduced to the term coronavirus, it's still here. In fact, worse than just sticking around, it's resurgent. Last week saw almost 500,000 new cases in the United States, the highest weekly total since the pandemic began. That's a new COVID case almost every second. And what of Michigan?
We are now at our peak when it comes to daily new cases. This peak is higher. It's higher than what we saw in April.
Researchers gave the state credit for bringing its early surge to heel, but things are different now. The governor's emergency powers have been reeled in by the state Supreme Court. Schools and universities are trying their luck with in-person learning. And now, cold weather sets in, changing the game at restaurants and bars. And so, what now? The coronavirus crisis. Where do we go from here? Tonight, from downtown Detroit on Local 4. Where do we go from here? A difficult question to answer as COVID-19 continues to spread through our community. Cases are up, and our coronavirus fatigue is setting in.
And tonight we look at what's being done to stop the spread as this second wave surges and take an in-depth look at the impact coronavirus has had on our lives.
We ask the tough questions of the major decision makers in our state, including the top doctor leading our response to the virus.
But let's begin with a look at the latest numbers. The state reported 3,168 new cases of COVID-19, and 11 more Michigan residents have lost their lives to the virus. That brings the total confirmed coronavirus cases to more than 174,000, and sadly, 7,309 people have died from COVID-19 since the pandemic began back in March.
Michigan managed to bring its first surge under relative control, but can we do it again?
It's a new season. We're all moving inside instead of outside, as happened in the spring. So what makes this challenge different? I asked that question of Governor Whitmer.
Governor, tell me a little bit about what you see as being different now. We've been through a surge before. Michigan kind of got a lot of credit for bringing it under control, but a lot of things have changed. Our understanding of the virus, people moving inside instead of outside as we were in the spring. Tell me about what you think it might be different about this surge.
Well, there are some things that are the same. Let me start with that. This virus is still a very real threat. It is still present all across the state of Michigan. Our knowledge of the virus has grown incredibly, right? We now know how important masks are, that they remain the single best tool we have to prevent spread of COVID-19. But I do think that we're so far into it, people are getting tired of it, me included, and yet we have to summon the energy to continue doing what we need to stay safe and to prevent spread. None of us, I think, while we're not unanimous in a lot of things in this very polarized political moment, I think we're unanimous in that none of us wants to have to move backwards and turn the dial down and shut things down. I want to avoid that. It's hard for so many reasons, and yet the trajectory that our numbers are on is very concerning. You look at the national map where we once were leading the nation. Since that Supreme Court decision and the confusion that has come from it, we've seen our numbers continue to climb. And it's why we are working so hard to try to encourage people to mask up. And I know the holidays are upon us. We're encouraging people to be smart and to not gather and potentially expose their loved ones to this terrible virus.
Can you tie a string between the Supreme Court decision and the uptick in cases, do you think? Or is that just purely coincidental because we're seeing rises everywhere?
Well, we knew that going into the fall was going to be inherently more concerning, right? When the temperature goes down, people come inside. And when we're inside and congregating, that's when it's most dangerous to catch COVID-19. So, to some extent, we knew this was coming. We've been warning people for months. But there's no doubt that the legislature's challenge of the powers and the Supreme Court's decision have played into confusion, have created the impression that we don't have to wear masks anymore, or that it is we're back to normal in all things, which is incredibly dangerous assumption that too many people are making. I know that there are confrontations happening in grocery stores, for instance, where people say, "Well, the Supreme Court ruled, and we don't have to wear masks anymore." That's not the case. We still have a mask mandate in Michigan.
The announcement that you made on Thursday afternoon, or that the health department made on Thursday afternoon, moving the whole state back into phase 4. Explain what that means. That now the whole state is back in the same spot, correct?
That's right. So we're all at the same phase. Sadly, we've seen an explosion in cases in the Upper Peninsula in northern Michigan. Obviously, their health systems, while they're great health systems, are not equipped to handle major outbreaks. And so we've been working very closely with the local departments of public health and the hospital systems and leaders at the local level. And there was no question that this was something we needed to do.
We also have a number of challenges coming just within the next couple of days. We've got the football game between Michigan and Michigan State on Saturday, and then the election. I know you don't want anybody to not feel like they should go out and vote, but give me your level of concern over these next 4 days or so.
Well, you know what, Devin, I'm a Spartan. I love a Michigan State-Michigan matchup coinciding with Halloween and daylight savings time. That ordinarily would be a great opportunity for celebration. But when we have a global pandemic and our numbers are on the rise, it is a recipe for disaster. On top of it, we see gatherings, whether it's political gatherings or otherwise, when people show up without their masks on and they're packed in, that's where we see spread. That's why we're really encouraging people. Don't wait until November 3rd and go stand in line for a long time with a lot of other people. Go now and cast your vote.
Now, when the governor makes any major decision related to COVID-19, Dr. Janae Caldoun is by her side, advising her on these medical issues.
Making expert recommendations on how we can stop the spread of the virus.
As the chief medical officer, she constantly monitors the direction the pandemic is headed. I had a chance to sit down with her to get her thoughts on coming months.
So let's start with the obvious. You know, cases were fairly steady over the summer, but they've been rising since the end of September and even more so into October. Knowing how diverse our state is, what are the prevailing thoughts in your department as to what's behind the increase?
Yeah, so I'm very concerned about what we're seeing now. Our case rates have more than doubled from what they were a month ago. We know that the age distribution of new cases has also changed, where it was previously the 20 to 29-year-old age group, and for recent weeks, it's the older age groups. So we're very concerned that it's community spread, especially since as our testing has remained pretty solid, we're seeing our percent of those tests coming back positive increasing. We're now over 5.5% with our test positivity, which is very concerning.
Now, in terms of the demographic that you're seeing it spread into older age groups. Ultimately, that will probably translate into more morbidity. Have you seen changes in hospitalizations as well?
Absolutely. We are seeing increases in hospitalizations all across the state. It differs a little bit based on what area of the state you're in, but we're seeing hospitalizations overall and deaths increase. And again, when we see our cases, we know that the hospitalizations are a lagging indicator. Once you start seeing hospitalizations go up, you're going to likely see those deaths go up a couple weeks later as well. So I'm very concerned about what I'm seeing now.
So the elephant in the room is clearly whether we are headed for another rollback in business activity, schools, or other public events, or maybe even a lockdown. From a purely medical perspective, what are the thresholds that you're thinking about that might drive those changes?
Well, we're certainly looking at the same data points that we've been looking at throughout the entire pandemic, how our hospital capacity is doing, our case rates, but not just our case rates, but also, of course, our hospitalizations and deaths. We're the surge that we're in, and I will say we're in a second surge right now. It looks a little different than it did back in the spring. We're seeing a lot more mild cases. That's probably because we're testing a lot more now than we were in the spring. But we're going to look at it a little differently. I can't say there's a specific cutoff point, but we're going to be using the authorities we have at the Department of Health and Human Services to make sure we're protecting people as much as possible. And part of what happened in the spring, it's not just that hospitals were determining what procedures they would or would not do, time-sensitive procedures. People, quite frankly, were scared to come out and seek care. There were a lot of things that were actually legal in the spring based on the governor's executive orders, but hospitals actually had to or determined that they would not move forward with them. But things like cancer screenings and making sure people are getting their well visits and childhood immunizations, again, those rates have gone down throughout the pandemic. It's very important that people still are able to seek care. What we want to do is be able to take care of COVID patients and non-COVID patients, and that's what our hospital systems are driving towards now.
So, we're months into the pandemic, and I think the prevailing thought among experts is that we still have a long way before we're on the other side of this. Everyone is frankly tired, and they're in need of a second wind to keep up your guard. Can you remind everyone how important it is to keep up your guard?
Absolutely. I mean, I'm tired of this as well. Everyone's tired. My children are on Zoom calls. They can't play sports the way that they would normally. We're all tired, but I think it's important that people just focus on the small things that you can control. We can get through this. We will get through to the other side. Doing basic things like wearing masks, avoiding those large gatherings. If you can, I know it's getting chilly, but outdoor is much, much safer than indoor. Please try not to have those indoor gatherings, even over the holidays, no more than 2 households together at a time. Wear your mask if you're indoors, even just very basic things, and washing hands and maintaining that 6 feet of distance. Those are going to be the bread and butter tools that we have to fight COVID-19. So everyone has to remain vigilant and just keep doing what you can and get your flu shot.
Now, Dr. Khaldun and I both work together in the emergency department at Henry Ford Hospital in Detroit. And just like me, she knows firsthand how devastating COVID is. Every action you take that puts others at risk has consequences. Breaking the chain of transmission is everyone's responsibility. And the more we reduce spread, the less disruption there will be to everyone's life.
All right, thanks, Doc. Well, this is an election unlike any other we've experienced. Early voting at record levels, much in part because of COVID-19.
Election day, just 4 days away. Help Me Hank consumer investigator Hank Winchester is checking in with Secretary of State Jocelyn Benson, making sure your vote counts.
We're a few days away from what looks like an historic election with this turnout. How are you feeling about being prepared for Tuesday?
I feel confident that we're ready to go. I mean, every step of the way, we've looked at the research, we've looked at data, we've implemented best practices, and people are voting as a result, showing they have confidence in the system as well. So look, this year has been an extraordinary one in so many ways, and this election is historic and already is historic because we've seen record numbers of people signing up to vote early, vote absentee, and return their ballots at a higher rate than we typically see with mail-in ballots.
The data and research are great, but the reality is, and unfortunately, historically in Detroit, there have been problems. With the primary, and usually it's technology focused, and sometimes it's as simple as people not showing up when they're supposed to be working. So What are you doing Detroit focused to make sure that those problems don't arise?
First, we opened 21 satellite clerks' offices all around the city so that you didn't see long lines outside the 2 permanent offices for people to register, pick up, and return their ballots. We installed 30 secure drop boxes all around the city, including one at the Pistons training facility where I'll be voting or returning my ballot on Election Day morning.
President Trump, he's come after you, and he has made it clear that he does not feel like he's going to get a fair shake in Michigan. How do you respond to that criticism, and how do you deal with that, knowing that you're being singled out by the President of the United States?
Well, it started back in May, so at this point, it's kind of just become an element of the job. But that said, my focus is just squarely on the voters, and I truly mean that. In that, my job is to make sure every ballot counts, that every voter, regardless of who they're voting for, can trust that that's the case, that their vote's going to count, that their voice is going to be heard.
What can you tell the voters what is being done right now to ensure that on Tuesday it is going to be safe for them to go vote?
Well, a number of things. First and foremost, we've prioritized protecting the health and safety of our voters in those precincts on Election Day and our poll workers. We've provided masks, gloves, PPE, put social distancing guidelines in place. This is notably the fourth election we're having this year, so we've really perfected a strategy of protecting people's health in the precincts, and our poll workers are accustomed to that. We want voters to wear masks as well.
And I'll be working all Election Day and through the night for you, investigating any potential problems at the polls. So I need to hear from you. These are all the different ways you can contact me and the Help Me Hank team as we look into any potential issues on Election Day. I'm Hank Winchester. Back to you.
And of course, Local 4 and clickondetroit.com has you covered for election night and beyond. Constant updates of local and national races, live tracking of the Electoral College count right on our home page, and interactive maps on the balance of power as well as what's happening in every Michigan county. Jason Carr, Grant Herms, and election experts will be live as polls close to help explain the results and answer your questions. We are in it for the long haul, so you make sure you spend your election night with Local 4 and clickondetroit.com.
Yes, certain to be a historic night. Now, coming up next, a crisis can lead to unexpected creativity. The next thing you know, you have an opera in a parking garage.
Plus, how the Lieutenant Governor is working to eliminate racial disparity and the personal story behind his fight. Paula.
A deeply disturbing picture emerging from Student Count Day in the state's largest school district. We're going to tell you the story behind the story of the actual numbers.